Hey, everybody. I am so excited to be back with you today talking all things perimenopause and menopause. I have Dr. Heather Elton with me today. She's just been just a gift to our clinic. We've worked together for several decades. You know, at the clinic,
Yes.
Ron, first introduced us to you. And so we've collaborated with patients over the years. And Dr. Elton has a passion with working with perimenopause and menopause just like I do. So I asked her to come because I don't have the depth of expertise that she does with some of the topics. I asked Dr. Elton, I wanted her to talk about three things today, a little bit about a Dutch test, and which I've taken one. I got to get my results yet. So, and what the Dutch test can help us as females. I know Dr. Minnie Peltz, are you familiar with her?
Yes.
She feels like if every female had a Dutch test, that we could eradicate breast cancer. So I'm really excited for women to learn about this test and the information that I might tell them to help you as a healthcare practitioner, help them out. The second thing, we're going to talk about a little bit about how nutrition can help us to synthesize hormones during our journey of helping them out with some of our symptomology. And then the last thing I asked her to talk about is adaptogens. And adaptogens, you guys, are over-the-counter like herbs that can help out for those people that may elect not to go through hormone replacement therapy of estrogen and progesterone, whether that be I'm very much an El Natural gal. I told you if I can do it with food and exercise, I'd much prefer that than a pill. But some people might have a family risk of breast cancer, or maybe they've gone through breast cancer, so that may not even be an option for them to help out with hot flashes or anxiety, and some of those things can help out with that. So we're excited to have her here. That's a little bit of an overview of what we're going to talk about if I can keep my glasses in my lap. But anyway, welcome, Dr. Elton. Just tell everyone a little bit about you, a little bit about your background, how you got in with perimenopause, in your practice.
I will do that. Well, thank you so much, first of all, for having me today, Lori. Honestly, it's been such a pleasure working with you guys over the years because the whole clinic here is it's a gift to our community and communities around. And so I'm so thankful that you're here. So, it's funny, I started my journey with functional medicine about 15 years ago. And back then, no one really knew what functional medicine was. It was something that was, a little voodoo-y or a little bit of just not a term that anybody knew anything about. And so to see this transform over the years to something that is talked about so much more publicly and accepted has been such a cool thing. But my background is I was a chiropractor for many, many years. I'm still a chiropractor. I don't see chiropractic patients. I only do functional medicine. But really, I had that foundation to help me understand, determine what the root causes were for pain, discomfort, all different types of issues. But my passion in my heart was so heavy for food and what food does to our body. And so my initial, vehicle into functional medicine was all about the fact that I wanted to learn about food and how could I optimize food in helping my body become healthier, but also how could I help my patients in that journey? Because I always felt like there was something missing in that connect with patients. And so I went into, I started taking a course. It was called, it was a clinical diplomate program in clinical nutrition. And back then we didn't call it functional medicine, so it was clinical nutrition. So I got my diplomate with that and realized that it was so much deeper than food. It was laboratory testing, being able to evaluate labs and determine how can we help women optimize their health, men too, but today specifically we're leaning into women and hormones. And so it has been such a phenomenal journey because after I sat for my boards with my clinical diplomate, then I went through the Institute of Functional Medicine as well, primarily because functional medicine is deep and there is we are dealing with so many different conditions and I'll never know enough. I'll never learn enough. And when I started to really dive into functional medicine, it was the law of attraction. Women started coming in. Obviously, being female helps. Obviously, being female in my 50s helps with the perimenopause to menopause transition, because these are the women that I am. I'm with these women. So it starts with your friends and your family, and everybody starts kind of coming in, and you become almost an expert by default when you're going through it yourself.
Yeah.
Right.
Yeah.
And so that is really, what drove me into functional medicine. It was initially food, and then learning that there's such a larger scope of being able to take a look at these deep dive laboratory findings to help people feel good through every age and stage of life. Because that is my biggest passion, is really understanding women are going through a lot. And unfortunately, a lot of times they're going to their practitioners and they're getting oh, you're just getting older. Oh, it's a hormonal thing. It'll pass. And I am so passionate about helping women progress through these stages of life and feel good at every age and stage, because I believe that it is absolutely possible. And from a functional medicine perspective, I'm not a prescribing doctor, so everything we're going to be talking about today is really the basis of how I want to help support women through this process, whether they are already on HRT or they are considering HRT, or they just can't or don't want to go down that road. I'm also a big advocate, obviously, with what I do, is natural first. And if necessary, we take those next steps.
So how did you you got into perimenopause with your age. So what would be like, so we've talked a little bit about the Dutch test.
Mm-hmm.
So let's talk a little bit about the Dutch test, because that can give you a lot of information to help out with the nutrition part, and then help out with the adaptogens part.
Right.
So let's talk a little bit about the Dutch test, what information that provides you in for people, just for you guys don't know it. She can explain what the Dutch test tells her, but more or less, I had to urinate at different times of the day, and which was not a problem. The hardest part for me is that I could not have caffeine.
Yes.
I could give up everything else, but you can't have caffeine. And I'm just like, okay, I got to do this on a day that I don't work.
Yes.
And you have to be very regimented about how much you're drinking. It really wasn't a hard thing to do, but the hardest thing for me was giving up my coffee. In the morning, it wakes me up. So anyway, talk about the Dutch test.
The two complaints I get are giving up caffeine, number one, and number two is you have a limited amount of water that you can drink when you're doing the Dutch test, and that's hard for a lot of people.
And it was an epic fail that I thought it was a good idea to work out that day. And I'm like, oh, crumb. Because I measured out my water for the whole day, and I'm like, oh, no. I can only drink this much water.
Yes. So the whole idea behind the Dutch test, what it is actually is a dried urine test. And it sounds like one of the craziest things. I used to do a saliva test for hormones, but then I learned about the Dutch test, and I will not go back from it.
The saliva test was a really big deal, or like people doing like blood work.
Yes.
And what I've learned a little bit on my journey, I'm not an expert like you are, is that it can change from day to day.
Yes.
And so anyway, I don't mean to interrupt you, but some of it is kind of going away from doing all the blood work or saliva tests routinely that you might get more benefit from this Dutch test. Okay.
You got it. No, so what the Dutch test shows us that I feel is above and beyond anything else that we have in the way that we can measure it through dried urine is we're able to see not just the different types of estrogen, the 3 different types of estrogen, because that, to me, I always say it's not the end game. The end game is how is your body utilizing the estrogen? Because we can see estrogen in blood and saliva, but what we can see in the Dutch test is we can actually see how you are metabolizing those hormones. And what that means is when you are utilizing and using up this estrogen, where does it go? What is happening to it? And what's so neat is estrogen can go down 3 different pathways. And estrogen, we want it to go down what's called the protective pathway, which is to the liver. And of course, then the liver needs to break it down into water-soluble compounds to be able to excrete it out of our body. So there's 2 phases of methylation. And I'm kind of a geek, so I'm going to try to, you just cut me off if you're like, too big of words, Heather, too much.
No. So, I mean, I think it's important. I don't know that most people know we have 3 types of estrogen.
Yes.
So you have E1, and that's really more prevalent when you are pregnant.
Yes.
E2 is what all of us, that's what we primarily, our body thrives on.
Mm-hmm.
And then we go through perimenopause, menopause, that's what kind of tanks.
Mm-hmm.
And then we have E3 in a smaller amount that kind of takes over more during late menopause, late perimenopause and menopause. How am I doing so far?
It's perfect.
Okay.
It's perfect.
Okay. So I've done my research a little bit.
Done it.
But yeah, so
you can see all 3 of those estrogens, but then you can also see how all 3 of those estrogens are breaking down and metabolizing in the body. So we want, for protective purposes, we want our used estrogen going to our liver so it can break it down and exit it from our body. But there are 2 other pathways. One is what we call a quinone pathway, which can put you at a little higher risk of breast cancer.
Okay.
So extremely important for individuals, women who
now I understand why Dr. Peltz likes it.
Yes,
Okay.
because women who are on HRT therapy, what is so great is we can see, where is this going? Is it going to the liver like we should use it after we use it? Is it heading to the liver? Or is it going down this quinone pathway that can be putting us at higher risk for breast cancer? And then the 3rd one is a very estrogenic form of estrogen as well, the pathway that it breaks down. So what it is those 3 pathways. The quinone pathway is the highest risk of breast cancer, but the estrogenic pathway can also be a trigger and an issue for people as well. So the neat thing is whether you're on HRT or not, we can see, where is our estrogen going? Are we getting rid of it like we normally should? Or do we need to support these pathways in different ways? And we can use supplements to do that. We can use exercise to do that. We can use castor oil packs, sweating. We can do all kinds of things. And basilicas, broccoli, cauliflower, all of those types of things. Wonderful to help support these proper detox pathways. But I think that's one of the biggest gifts with this test is we can actually see, how are we metabolizing the estrogen, and are we putting ourselves at risk by even the adaptogenics that I use in the clinic as well. So I use them in different ways with different people, depending on what we see in that portion of the Dutch test.
So you're using that Dutch test to help determine what you're doing with people.
100%.
What does it look at progesterone at all?
Yes,
Because they're an agonist and antagonist to each other.
Exactly. So it also measures progesterone, and then it measures testosterone as well. And so obviously with estrogen, progesterone, we want to look at those ratios, because the progesterone is very protective if the estrogen is higher. Now, if we have high estrogen and unopposed progesterone, that's going to put us at higher risk too. So we can see all of those different things. Now with testosterone can break down 2 different pathways. One's very androgenic. One is what we call the beta pathway. So the androgenic pathway, if we're breaking more testosterone down that pathway, we feel it more. So that can be a great thing for libido and strength and energy.
Is that what, because it's our facial hair?
Yes, exactly. That is the far side of that androgenic side. We grow the little beard.
I went into my physician 1 year for my annual checkup. He goes, Lori, how are you doing? I go, other than growing a mustache and a beard, I'm doing great.
Yes.
My hair's thinning.
Yes.
Okay, anyway, I digress.
Yep. So that's exactly where that comes from. I see a lot of women with jawline acne as well.
Okay.
And so that can be an issue.
So that's it. That's the part of the testosterone. Okay.
Exactly. So if we see it going down that androgenic pathway, we know, all right, we need to bring something in to help calm that down. Now in men, when it goes down that androgenic pathway, it puts their prostate at risk. So they can have more issues with enlarged prostate, prostate cancer. So that's where we bring in saw palmetto or zinc picolinate, because we can help push that androgenic testosterone more towards the beta pathway. But on the extreme side of it, of course, there's always 2 extremes. If you're going too much down the beta pathway, that can make you not feel that testosterone at very little. So that means lower libido. It means lower energy, poor exercise recovery, and usually it's easier for us to hold on weight as well.
Okay.
So that's the sex hormone portion of it. But the cool thing is the Dutch test also, it tests two other areas, and one is the stress hormones, because one of the most important organs that sit on top of the kidneys in postmenopause or peri to menopause transition is our adrenal glands. Women, if you are under a ton of stress, I will tell you that the transition into menopause is going to be a lot harder. And most of that is because those adrenals produce something called DHEA. So DHEA used to be called kind of the youth hormone, and they used to say, oh, everybody needs to be on this, everyone needs to be on this. But the problem is DHEA, it's a good thing and a bad, but DHEA breaks down into estrogen and testosterone. So post-menopause, if we don't have a somewhat robust DHEA, which naturally decreases as we get older anyway, but if we are under a lot of stress and it's extremely low, that can also really impact our estrogen and testosterone levels. Because when our ovaries are done doing their thing, that's where DHEA, there are other sources of estrogen too, but DHEA really takes over at that time. And that depends on the health of our adrenals, where that's at.
And that is at the estrogen 3, the estrogen.
Yes.
E3.
Yep.
It's in the adrenals.
Yes.
Okay.
Yep, exactly. So basically what we want to make sure is we're supporting those adrenals, supporting those stress hormones. And yes, we can do that with adaptogens, but food, nutrition is a huge part of that as well. Gut health, and we can, that's a whole nother episode probably to go down that road. But all of those things impact our adrenals. And so we can see that. We can see cortisol, we can see cortisone, we can we look at melatonin on this test as well, which is what is produced at night when we sleep. It helps us sleep better, which of course can be an issue in menopause as well. But then the third portion of it is we also test something called organic acids, which it looks at a few different vitamin nutrients, a couple of different B vitamins, glutathione, all really important for those detox pathways. Because if those are deficient, that can slow down our detox pathways. The methylation pathways I was talking about. And then it also looks at dopamine, which is our motivation hormone, norepinephrine, epinephrine, which are our flight and fight hormones as well. And there's one really important that I like to look at for menopausal females or perimenopausal, and that's called quinolinate. So quinolinate ties into inflammation in the brain and the nervous system. And when that is elevated, it can really fuel the fire on our brain fog. But that comes back to the health of our diet is a big portion of that, and our mitochondrial health as well. So those mitochondria, I know I don't want to go down too many rabbit holes, so we will be here for 2 hours.
Mitochondria they're powerhouses. They're very important. And if your mitochondria are in your cell, you guys, and your mitochondria are really important for. They tell your cells kind of what to do.
Yeah.
And it can help out with diabetes. It helps your cells to function. And if your mitochondria aren't functioning, your cells aren't going to function in your body correctly. 100%. So you want your mitochondria working.
Yes. Do you remember the Krebs cycle back in school?
Oh gosh,
it was an awful thing, right?
Don't take me back to physiology.
No. It was terrible. But that occurs inside the mitochondria. It's how we convert food into energy. And if you ask Mr. and Mrs. Google, it will tell you how many conditions are now tied into mitochondrial dysfunction. And they're just doing a lot more studying on that. It's so fascinating and so interesting. But man, if we're not fueling our body well, if we aren't getting enough sleep, if we aren't hydrating well, if we're not moving, if we're not exercising, all of those things can really impact the health of our mitochondria. So,
and there's a good book, you guys, by Dr. Cassie Means, Good Energy, and she's a physician.
Yep.
And she tags a lot of our chronic fatigue syndromes, diabetes. A lot of chronic illness is tied to lack of function of our mitochondria related to our diet.
Yes.
So it's really right on point.
So good. Yeah. Yes. Yep. It's on my bathtub. I am picking it up and reading it from time to time. I just love it. It's a great book.
So once you look at the Dutch test then, so that helps you to make different
recommendations
then for
Absolutely.
nutrition.
Yes. Yeah.
And I will just speak, I mean, not that everyone here wants to hear about Lori Thompson's story, but, you know, I noticed like when I did a low carb a low carb and I like low sugar.
Yes. Yeah.
And I did getting off of seed oils was life changing for me. If you were going to make me pick, I could tell a difference with being low carb, low sugar. I try not to eat more than 12 grams of sugar in any kind of serving.
Yeah.
I don't know that a lot of people realize, like, if you eat a bagel and a bagel has 0 grams of sugar, but it has 30 grams of carbs, you guys, that gets converted into sugar in your body when it metabolizes. I don't know that a lot of people realize. I mean, I can't remember what the figure is, how much we eat in sugar in our diet. But, and I did that and I my brain fog got better.
Yes.
But then getting off of seed oils in the last year for me was like an over the top experience. And your seed oils, you guys, are your vegetable oil, your canola oil, your grapeseed oil. Anyway, those are, it's not the oils themselves, it's how they're processed. And how those seeds are broken down is very toxic for your body. And so it's much healthier to go back in the olden days at my 55 years of age where we used to have like beef tallow. McDonald's French fries were deep fried in beef tallow and then they switched to vegetable oil.
Yes.
So our generation grew up with like beef tallow, ghee, butter, bacon, fat, animal fat stuff is better. Coconut oil is healthy. A little bit of avocado oil, a little bit of olive oil is okay. But your better oils to cook with would be ghee butter, beef tallow, coconut oil. Am I forgetting any of them? Duck fat.
Yeah.
Like your animal fats are better. Now, I'm not saying to go out and eat 50% duck fat in your diet.
Yeah.
But anyway,
yeah.
I don't mean to take over, but I just talk in nutrition, cleaning up my diet. If I could simplify it, just stay on the outside of the aisle. Sometimes you think you're eating healthy, like getting a trail mix with nuts. And then you look in the ingredients and it was roasted in vegetable oil. Yeah. So it ruins it.
Absolutely.
So you just got to, and if you have 50 ingredients of things you can't pronounce, it's probably not that healthy for you. So,
yeah.
But
no, I everything you said is right on because really, you know, people will always say, hey, tell me. In fact, I was just out of town and I had someone say, hey, what would your 3 tips when they found out what I did? What are your 3 tips that you would tell me? What should I be taking? And I said, it's actually not in a pill form. Number 1, it's diet, diet, and diet. And it's not going on a diet, but it's removing the things that are, you know, just causing such inflammation inside of our systems because those will fast forward aging. It will fast forward in any inflammatory condition, including cancers, including, you know, and I'm not saying that our food is causing our cancer. Maybe we could go deep into that as well, but it can either help or it can hinder all conditions, all inflammatory conditions and heart disease, you name it. Like it is the number 1 thing that we want to change. And you hit it with seed oils, removing added sugars, highly processed foods, removing anything that has a label that you don't, like you said, if you can't identify the ingredient, take it out. If they're added colorings or preservatives, done. Don't even consider it.
I mean, our brain needs healthy fat. You know, like if you look, you know, my dad recently got diagnosed with Alzheimer's and just, you know, they're even recommending low sugar, I'm having a brain. I'm having brain fog right now.
It's okay.
But your brain needs healthy animal fat.
Yes.
And so we get on this low cholesterol diet of going on low fat, and it's really more about the bread, the sugar, and low carb diet, more so with cholesterol than it is about fat. And our generation grew up with low fat diet.
Oh my goodness. I was going to say.
What the cardiologists will tell you is that they saw an increase of cholesterol medications skyrocket and cholesterol numbers went up because everyone was eating a low fat diet. But what they didn't realize, they were putting all the sugar in that food and it caused cholesterol levels to go up.
Exactly. And you know what happens when we suppress cholesterol? Cholesterol is a precursor to our sex hormones. So you've got men with erectile dysfunction. You've got women who are dealing with higher issues with a menopause transition because their estrogen, testosterone, everything's going to be lower when we suppress it. And I'm not talking about like a normal level, but sometimes we're medicated to the point where it becomes too low. And I see that frequently in my office too, where it's too low, where we think, oh, my cholesterol is amazing. In reality, no, we're doing a disservice to our hormone panel for sure. And so yes, we absolutely grew up in the low fat. Everything was low fat, low fat. Yeah. And it's so bad for us because you think about our nerves. How do our nerves communicate with one another? It's through the myelin sheath, which is fat.
Fat. Yep.
It's fat.
Yep.
We need the fat.
Yep.
We need the fat.
Yep.
Eat the fat. Now, the one thing I will say is being cautious with like cholesterol. Individuals who do have high LDLs. We don't want anybody panicking and having their cholesterols continually rapidly increase. And coconut oil is one that can do that. So I do have people a little bit more limited on that if they have a tendency towards higher cholesterol. So I just want to point that out too, that one can increase it. But otherwise, I love coconut oil is my absolute favorite thing to cook with. So,
I've transitioned to that.
Yes,
Yeah.
Love it.
Anything else you want to like overall, like with nutrition?
Yeah, I think one of the biggest things, and you know this, we talked about this last time in our last conversation, protein. Women need protein. And, I think you encourage your patients as well, getting in a good gram of protein per pound of body weight, somewhere around that area.
1 pound for 1 gram of your ideal body weight.
Mm-hmm.
And I will tell you, it's probably the hardest thing for people to do.
Yes.
So I have right now my little protein shake.
I love it. I love it. And it's true. I can tell you out of, the amount of patients that I saw today, I would say over half of them, the conversation revolved around how do I get more protein in my diet? And I think it's key. We don't want to overfill ourselves, but sometimes we're filling ourselves with absent calories that, again, when you're eating carbohydrates, and we're talking about the pastas and the chips and crackers and some things that you don't think, oh, there's really but I'm eating gluten-free pasta, right? Well, if you're eating enough carbohydrates in a sitting and you're not exercising around that period in time, we are not going to need to use those carbohydrates for energy. So they're going to get stored as fat. And I think that is key, is trying to get that ratio of protein really up nice and high, those healthy fats in there, being cautious. We don't want to do low carb unless, you're working with a physician and monitored in that way. But you don't want to do extremely low carb because that can be difficult or cause issues too with your thyroid and that type of thing. Now I'm talking about really, really low carb. But it's important to make sure that you're getting the protein portion of it in, because we need it for our brains. We need it for our muscle. As we know, as we get older, things just aren't as tight as they were anymore. I don't know if you've noticed that, but I surely have noticed that. And they're just not as tight as they are. And protein is a huge portion of that too. So, So on the nutrition side, I think, keeping things clean. I always say just whole food diet. We want food that is God-made, not man-made. And like you said, perimeter of the grocery store. So extremely important.
Any foods like you recommend, like that are beneficial to help out with estrogen or progesterone, like a few of those little tips?
Yeah. So I really like flax seeds. I do ground flaxseed because sometimes people have diverticulums.
Well,
and
they can make you get a little gassy.
They do.
Okay.
They do. So you have to proceed with caution.
Proceed with caution. The flaxseed, from someone who may have experienced that.
One of the reasons I love them is they can act like kind of like a phytoestrogen in the body, so they can mimic estrogen in the body.
Okay.
But it's what I like about them is they help to support a little support in that estrogen side, healthy estrogen side, but then they also help us poop more. And constipation is a big thing for women in that season of life. And so flax seeds, and I usually will have people do 1 to 2 tablespoons, mix it into a protein smoothie. And it's a wonderful way to keep things regular, but you do have to monitor. If you find yourself getting distended and gassy from it, you just got to back down and back away. Now, chia seeds are another great thing that can be really helpful with our digestive system as well. You can put chia seeds in a tablespoon in a glass of water and squeeze some lemon in there, room temperature water, and drink that first thing in the morning. A wonderful way to start getting your GI system kind of moving and grooving. And that room temperature water is important because it helps to support digestion, whereas the cold and first thing in the morning can actually suppress that and shut it down a little bit. So I love those. But pomegranates are wonderful to help support healthier estrogen levels. Berries are wonderful. So it's funny how much medicine is in nature.
Yeah.
When we take a step back and look at it. But those are some of my favorite things. There are more too, but those are really probably the top ones. A flaxseed is just one of my big go-tos, but do proceed with caution.
Okay. So let's talk about adaptogens. I love hearing about the other stuff, but I think for I have some friends that are breast cancer survivors. I have some that are at risk in their family for breast cancer. So they're having, symptoms like hot flashes and anxiety, but they don't feel comfortable doing hormone replacement therapy of estrogen and progesterone, and they want to do more of a natural route. And I did a natural route. And it seemed to help until it didn't help. But I will admit that I did not have your help at this time. I was like going at it alone. But to talk to us about like ashwagandha, I know is a popular one that can help out with hot flashes. Just a little bit of like holy basil. I know like Lion's Mane is over at Whole Foods. Some of these are just over the counter that can help reduce estrogen. That even hormone replacement therapy, you guys, doesn't replace your hormones.
Correct.
And so adaptogens are a nice thing, maybe to help out with hot flashes, to help you to feel a little bit more calm if you feel wound up. Or anyway, I'll let you talk and I'll be quiet because there's a whole list of them.
Yes.
And they have been. I should mention that these have been studied by the National Institute of Health and by the Menopause Society, and they have been found in research to have benefit. So we're not talking about anything that hasn't been researched. They're just not FDA approved.
Correct.
But they have been researched and have been shown to be effective. So I wanted to make sure that was clear, so you're not doing some like black magic or something with this.
Right. Yes. And, adaptogens absolutely can be helpful in those situations. One that I really like is black cohosh. Now, black cohosh, when we talk about, like the individual who had breast cancer, who can't use HRT, what I love about this approach is, number one, doing the Dutch test to see how are they breaking down and how are they detoxing their estrogen. But number two, black cohosh can be really helpful with night sweats and hot flashes and that type of thing. It once was thought that it was a phytoestrogen because even with these adaptogens, those phytoestrogens can still, put you at a little bit more of an increased risk. Now, not as much as some of the other things and, obviously the synthetic estrogen and that type of thing, but there's still that concern there. So we still want to keep our eyes on that. But one of the great things with black cohosh is it was once thought that it was acted as a phytoestrogen, but now through research, they're determining it is more helping to support the neurotransmitters of the brain and having that backdoor effect on how your body is responding to obviously this drop in estrogen. So I like using black cohosh because it's probably one of my most successful things that help to support the hot flashes. I also really love maca. Maca is you can get it in powder form. You can also get it in a capsule form. But maca is wonderful for a few things. One, it's great with night sweats, night sweats and hot flashes. But it's also really great to help support energy levels. And it can boost up, like ashwagandha can too, it can boost up testosterone levels through a backdoor support as well. We're not putting pellets in, we're not doing anything like that, but it's just helping your body's natural ability to make a little bit more of that, or improve and make a little bit more of that testosterone to help a little bit with the libido and and the exercise recovery and that type of thing. So we've got black cohosh, we've got maca. I also like dong quai. Dong quai is,
I haven't heard that.
Yeah. So dong quai it's a phytoestrogen, so it mimics estrogen in the body. So it is not estrogenic, but it mimics its chemical structure is so close to estrogen that it will adhere to estrogen receptors and act like estrogen in the body. But it's one, again, you want to be careful depending on the patient's history and how they're detoxing that estrogen. But dong quai I really love in the transition between the peri to menopause, because women, we grew up thinking you went into menopause and your period just stops. It's like it just stops coming so frequently and then it goes away. But we know, working with women, that it can be a raging bull before it stops.
Yep.
Meaning it can sometimes come for days and days and days. It can be heavy. It can be, an absolute nightmare. And that's where I love to bring dong quai in, because it helps with the menstrual cramping that sometimes we get. So it helps with menstrual cramping, and it can help with the heavy flow of the cycle as well. So dong quai is beautiful during that transition time, but it's also can be very helpful to help with supporting natural, I say natural, but it's that phytoestrogen approach. So again, it mimics estrogen in the body and acts like it. So your body recognizes it as estrogen. And it's incredible how our body says, okay, now I don't have to deal with the temperature changes, the lack of control of temperature and everything else that we deal with.
Was it the one that supports the neurotransmitters of the brain that you helped out with brain fog? Does that help out with like anxiety? Does that help out with some of the depression? Because your neurotransmitters are so, your estrogen, you guys, crosses your blood-brain barrier and is really, it affects serotonin, which is a neurotransmitter. And that serotonin is what helps to give you melatonin, which helps us to sleep.
Yes.
And then the serotonin is also helps out with our mood. And so if it affects your neurotransmitters, I'm wondering, does it help out with mood? Like with some people that might feel a little bit more down, or in my situation, I get more anxious.
Yes.
I'm already a tightly wound individual, but I'm sitting at the lake and I'm like, why can I not calm down? Why can I relax? So does it have that effect too with some of the mood?
Yeah, the black cohosh can, for sure. I love something called phosphatidylserine. Phosphatidylserine is phenomenal to help with the anxiety portion of it, because it's very brain supportive and brain protective. So it helps to support those neurotransmitters and the production of those. So phosphatidylserine is probably one of my favorite to help with anxiety, because sometimes, I've worked with women who, had no anxiety whatsoever, went through this shift in estrogen, and all of a sudden they can't even leave their home. And they're absolutely debilitated by anxiety. And phosphatidylserine, obviously medication is something to discuss at that point too, but phosphatidylserine is one of my favorite things to use in that situation. There are things like 5-HTP, which can be fabulous for that. Rhodiola.
Rhodiola is one I've heard about too.
Yes, holy basil. Those are wonderful.
And I heard ashwagandha is a very calming one too, and can help out with hot flashes.
Yes.
I'm a novice with this stuff.
So I'm going to definitely hit on that one, because it is. Ashwagandha is a gem for sure. I just want to mention one thing, like the 5-HTP, that's something that if people are on anti-anxiety medication, SSRIs, we can't combine those two things because of the serotonin response, and we don't want to overdo that. So you just have to really make sure you're working with somebody. You can go and buy these at any health food store and that type of thing, but you really want to make sure you're consulting with somebody to make sure that you are getting good advice and not intertwining the adaptogens with the pharmaceuticals, because there can be some interactions there for sure. But on the ashwagandha side, so ashwagandha is fabulous, because one of the things that we see, like I said, in the Dutch test is we can see where those adrenals are in play. So what's important to understand with adrenals is there are 3 different phases of adrenal fatigue. The first phase is when DHEA, metabolized cortisol and free cortisol, when all 3 of those markers go high. That's the alarm phase. That's the acute, oh my goodness, and we're built that way to run from a bear. If a bear comes, we better know what to do and get out of there. But what happens is we kind of get stuck in that position and we go into the alarm phase. And the second phase of that is the adaptation phase. That's usually it's DHEA comes down first before cortisol. And phase 3 is when not only DHEA comes down, but so do the two metabolites and free cortisol. The reason I tell you all of that is because there are different supplements, like you'll use holy basil in one phase of that, and you'll use rhodiola in another phase of that, or passion flower, valerian root. But ashwagandha can literally be used at any of those phases because it's an adaptogen, which means that if you are going high, it's going to help. It should help to start to bring those down. If we've already gone past the high state to the point where things are getting too low and you're getting towards near that adrenal fatigue, it can help to pick up too.
Okay, so it's flexible.
It is. It's very flexible, and I like it as well because it also has a little bit of influence on testosterone. And we think about testosterone like it's such an important hormone. We talk about estrogen and progesterone all the time, but testosterone is super important too because it helps to give us energy. It helps to make us feel vibrant. Obviously, it helps with libido and in relationships and those types of things. But ashwagandha can help to give that a little nudge too and push that up as well. So I love using ashwagandha. Now, with anything, just like medication, there can be side effects and that type of thing. And ashwagandha, probably one of the only side effects that I've heard in office with that one is nightmares, of all things. And I'm assuming, it's changing the neurotransmitters of the brain. And so there's activity happening there, but it's pretty rare and pretty infrequent. But like anything, we've got to look at those side effects as well. So.
All kinds of, I just think, I've read about adaptogens, and you can read about them online, Dr. Google, you can read about them in books. But it's overwhelming because you don't know what the dosage is, like, what can you put together? Because they talk about, like, you don't want to pair this with the, you know what I mean?
Right.
So I would highly, highly recommend for those of you out there, to go to a professional.
Yeah.
So is there anything else that, just like Dr. Elton is here in Lincoln, tell them where your practice is and the name of your practice. So if they want to get in contact with you for the Dutch test or to come and have a consultation with you.
Right on.
Yeah.
Yep. So I practice at my office is called Movement Chiropractic and Integrative Wellness. We are over off of 84th and Highway 2 area. The good thing is too, I do virtual and
so people are out of town and they want to,
Yes.
you can do it that way too. That's
absolutely awesome. Yeah. So we have patients throughout the U.S., which is pretty cool. And of course, we're on the interwebs, and movementig.com is our website. I also have a website, drheatherelton.com. And of course, the Instagram, Facebook, all those lovely socials as well.
And we'll tag her and her office information too with underneath this too.
Yes.
So we can do that too.
Yeah.
For those of you that are on, I saw that there was one comment made probably about 20 minutes ago. A lot of this conversation is resolving around the overarching concept of insulin resistance because you're affected.
Oh my
I don't know if
goodness.
you want to comment on that.
Absolutely. Yes. Insulin resistance is it's a significant issue, and blood sugar in general. And we're talking about, taking a look at how we're fueling our body and keeping our blood sugar nice and neutral. It's something we talk about every single day in my office with our patients, because when blood sugar is not on a nice stable level, it's going to increase issues with our hormones. It's going to increase issues with our gut health. It's going to increase issues with our adrenal health. It impacts everything. So much of getting that protein in there is also to help keep that blood sugar nice and neutral. And when you get into the place of insulin resistance, it's basically when your body, I always say insulin resistance is when you walk by a carbohydrate and you put on weight. Like, it's so hard for those individuals to lose weight. And that is one of the things that we look at is we look at what's going on with the gut health. We look at the gut biome and see what's happening there. We take a look at the adrenals and we look at the sex hormones and DHEA with insulin resistance. You know, we talk about how that can be so helpful. We need this, but sometimes DHEA can go too high. And that can contribute and go hand in hand with that insulin resistance. And one of my favorite things from a supplement standpoint with that is inositol, or ovasitol is the one that we happen to use, but it's inositol. Chromium cinnamon, putting cinnamon on your food as well. Obviously, that's not going to completely take away insulin resistance, but things like berberine can be really helpful with that. But there are different supplements that you can incorporate in. But yes, it definitely comes down to restoring the diet and making sure, because so many times my postmenopausal women are not eating enough calories. They have their metabolism, everything is shut down. So it's trying to increase their food intake slowly, but the right macros, the right protein, fats, etc., to help support that portion of it. But there's a lot that we can do through supplementation. But even, I wore a continuous glucose meter for a while, and it was shocking to see how I would eat rice, or I would eat, banana, like little dehydrated bananas, or I would have a banana and boom, my blood sugar would skyrocket. And I think those continuous glucose meters are phenomenal, because when I have postmenopausal women who are struggling to lose weight as in the insulin resistance issues, one of the things I like to do is have them wear one, because you can actually see like live information to see, what is this food doing inside of me? What is the stress doing inside of me? Am I actually over exercising and causing, my blood sugars to increase from that as well? So yeah, insulin resistance is super common, and it can be stubborn for sure. But the neat thing is we have so many, tools to be able to support that. And a lot of those tools are in nature.
Yeah.
Pretty cool.
Yeah.
Mm-hmm.
So anyway, if anyone, you can comment if you guys have any questions. But if not, I am so grateful that you are here. A wealth of information.
I love it.
I want people to have an avenue to, we can empower ourselves during this journey and still be active and still feel good. And
Absolutely.
I'm really happy to be done with the tampons and all the things, but I just didn't know all the other stuff came with it. So,
and that's why I'm so thrilled that you are bringing this to light. And we were just talking about it before we came on. And one of the things you said was, I just talk about it to everybody, but amen to that, because we need to be talking about it as women. We talked about how our mothers never talked about it. Nobody said anything about it. And it can be a real struggle, and we need to be more open. We need to be talking about, we need people like you getting louder and educating women,
because the other generations behind us are going to be educated about it.
100%.
Because I had no clue. I just thought, when I'm done with my period, I didn't, what I mean? So anyway, so I hope the other generation will be more prepared and more empowered as they transition, because they got to help out with the transition if they're starting to do some of the stuff we're talking about. And, it is overwhelming. I have to eat a certain way. So I told my husband the other day, I go, I'm tired of making protein shakes. I'm working out. You have to do hard things, but at the end of the day, I feel better.
Yes.
And that I did, a year ago, when some of started with more of my symptoms and stuff. And I think back to a year later, and I'm just feeling as vibrant as ever in my double nickel years. So anyway,
I always say, choose your hard. Right?
Yeah.
It is hard to make the changes.
Yeah.
But it's also hard to feel junky.
Yeah.
So
thank you for all of you that joined us. And for those of you, if you have questions, you can email me at the Hereska Clinic. Or, we could get you Dr. Elton stuff if you're informed with her. I am going to be interviewing Amy McCracken next week, and she's going to be talking about hormone replacement therapy. And I know that you and I have talked about that once adaptogens, or you do all this wonderful testing, and if that isn't working or resolving the symptoms, that's when you would recommend that people might need some hormone replacement therapy. And I'm going to have Amy to talk about some of the myths and misunderstandings with hormone replacement therapy and how that can maybe help people on their journey as well. So thank you for joining us and have a great rest of your evening. Thanks, Heather.
Thank you. Maybe one more time.